Medicaid matters
because many rural hospitals and clinics rely on Medicaid to keep their doors open. I'm really concerned that many of these rural hospitals and clinics will have to close.
Because as a diabetes nurse, our patients rely on medications to keep them alive.
because of our humanity. Blocking access to health care is inhumane.
Without Medicaid,
my patients, our patients, will no longer come in for their medical care. Well, they won't come in and get their pap smear. They won't come in and address the acute low back pain, which could lead to chronic low back pain, and it could lead to losing their job. But if they could come in and get that addressed from the get-go, it could prevent a whole negative downstream effects. Losing Medicaid will have a huge impact.
working families that I take care of can't afford the medications for their kids, so they have to stay home and go to the emergency room and take more time off work, making it even harder to afford the basics for their kids.
Patients will continue to get sick, and they'll get more sick, and they will continue to only be able to receive care in the emergency department, which is not the appropriate place for people to receive primary care and to have their illnesses treated.
I see the impact of Medicaid every day in our community health center, where we see firsthand how Medicaid transforms lives in rural communities. Keeps our doors open, our staff employed, and it ensures that being rural doesn't mean going without health care.
When my patients are able to come in for the preventative care and able to afford the medications that keep them alive and thriving.